So why on earth would we ever do free consultations? Why would we do that? What's the whole point?
I would say if you want any new patients coming through the door, maybe.
Sure, why not?
Do you want to help people? Free consultations are something to get people in the door, to let them experience your office and what you have to offer, and your team and the atmosphere that you have.
Right. Believe it or not, I think a lot of people get it, a lot of docs, a lot of offices get it completely backwards. You know, they think, well, we need to evaluate whether this patient is right for our office. And they forget that the patient's evaluating whether or not we're right for them. And that's something that we need to take into consideration when we're doing that. Why not give them a free consultation? Tell them what we think, tell them what we see, you know, give them some x-rays. That's not a big thing. You know, I mean, explain to them, you know, give them a little bit of our time, explain to them, you know, what our office, you know, why our office is unique. I mean, you know, that's what normal business does anyway. Somebody comes in the door and they try to win their business, and that's you know, it's a concept that for some reason hasn't caught on in our industry.
I think that not many people are calling asking for a free consultation unless you're marketing it somewhere.
Absolutely.
But the ones that are, they're wanting to interview you and your office because they've had a horrible experience, and they want to know, okay, is this going to be a right fit for me?
Right.
I don't want to go through what I've gone through.
Right. Absolutely.
You know, in the past.
I don't want to go to 15 offices to try and find out what office is right for me.
Yeah, so we had a patient that called the other day that she had just moved to the area from out of state, and she had been to the doctor,
Great story.
Or you know, to her dental office a few weeks before she had moved, and she had quite a bit of work that needed to be done. And so she called and she said, I have my x-rays, I have everything that needs to be done. You know, could you look at it? Could you kind of give me a second opinion and make sure before I schedule all of that? You know, I'm not really sure what I need to do. And I said, yeah, absolutely. We'd love to have you come in for, you know, a free consultation and, you know, look at everything, make sure you bring your x-rays and everything like you said you had, and we'll go over everything and kind of give you an estimate of what it would be and, you know, what Dr. Mohan's opinion is here for that. And so I just went over that with her and made her feel really welcome. Yes, we would love to take care of you, you know. And so
as
she
opposed
scheduled
to the people that answer the phone, what do you want?
Yeah.
You know, why are you bothering me? Why are you calling on my phone? Why are you, you know, I mean, you know, they're annoyed by people that call on the phone and they don't realize that patient is paying their paycheck.
And I think a lot of times offices or teams look at it like, well, we have no production for that 40 minutes or that hour then. You know, how is that going to work?
But what do you gain?
You gain a whole case, a new patient. What's the value of a new patient?
What's the value of a new patient that you wow so much that they can't stop but tell everybody else that they know about it?
Priceless.
Yeah, priceless.
So consultations are something that we use for people, you know, not only in marketing. We do a lot of free consultations for Invisalign, sleep apnea, snoring, you know, different, you know, niche services, as well as, you know, front office wise, when we're on the phone with somebody, really talking to them and, you know, if they have a lot of questions, inviting them in for a free consultation. Like I said in the beginning, to really let them experience our office and who we are. But
interestingly enough, in dentistry, there's a big push that giving away a free exam and x-rays is cheapening our profession. And I gotta say, why? I mean, what could it possibly be doing that's hurting anyone? You know, that is a dentist playing against another dentist, not so much, you know, the patient is happy. If you make the patient happy, that's all that really matters. I don't have to please the dentist down the street. I don't have to please, you know, anybody else. It's really about me and how I decide to run my business, and I'm very comfortable with how I run my business.
And a lot of times they're just looking for, you know, I had a office call me the other day that said, you know, we got a patient in for a no-charge, you know, consultation, and, you know, we needed to take a couple PAs to see what was going on with the tooth they wanted a second opinion on. So do we charge them for those?
No way.
No. So, I mean, a couple x-rays or whatever it is, no, absolutely not.
How much, I mean, once you have an x-ray system, especially digital, like a lot of us have now, how much does it really cost us to take an x-ray? A couple minutes of the assistant's time. That's it.
Yeah, so making sure that, you know, really taking care of that patient, making them feel welcome in your practice, letting them experience it, that we give them a dental experience, not just a dental appointment, and then making sure that they feel comfortable going over all the steps, you know, that we have with them in that free consultation, and then our ultimate goal with that is to schedule them back for their treatment that's needed.
Of course, And giving the patient that experience and that wow experience that we're looking to give is so valuable, and that patient, if they tell enough people, you won't have to do much marketing. You know, your one marketing technique, you know, free exam and x-rays, free consultations, that can be a big thrust of your marketing, and you don't have to worry about too much past that.
Yeah. So free consultations are a great thing.
Yeah, they really are.